I want to, give people a little bit something really tangible, which is
Sure.
some people, and a lot of them are unknowingly taking medications thinking that they are good for them
Hmm.
and they were prescribed by doctors. So you mentioned a few general categories of the damages they can do.
Sure.
So I want to kind of talk about those categories and which medications belong to those categories. So you talked, quite a bit already, but I kind of want to give people a little bit, maybe something that they can grasp onto.
Okay.
So nutrient depletion was one category you talked about. So
Sure.
which ones are, you think, some of the most common but alarming medications?
Well, let's recap. Let's talk about statins and CoQ10. We're going to talk about our acid blocking medicines with magnesium and vitamin B12 and vitamin C and iron are all up in there. The diuretic medicines that are used to treat high blood pressure are also depleting magnesium and zinc and CoQ10. Antidepressants decrease calcium and vitamin D, oral contraceptives, magnesium and vitamin B12. And then, one thing that we haven't gotten into extensively, but that I'll highlight here is the disruptions that happen with our microbiome. So we have the nutrient depletions, but the medicines that decrease our acid in our stomach, the proton pump inhibitors, the H2RAs, those also can reduce our microbiome. We know that metformin changes the gut microbiome, and can actually make itself less effective because of the way that it changes our gut. So when I think about medicines that really truly affect the microbiome, I think about anything that causes diarrhea or constipation.
Mm.
So we have to throw the opiates in there, calcium supplementation, laxatives, anything that causes constipation or diarrhea goes in there. I think of anything that changes blood flow. So aspirin, the NSAIDs, the Advils and naproxens of the world, as well as the antidepressants, also have a very, very strong impact on our microbiome because the microbiome is responsible for most of serotonin production. And so, if we're manipulating serotonin reception, it's going to affect our serotonin production because that's the way that hormones work. They have to be produced and transported, then they have to be received, and then they have to be detoxified. So those are just some big classes of medicines. But listen, I don't want people to walk away feeling like they're at a dead end, because we talk about like, oh no, medicines, and you got to like go on this healing journey for life. Like, congratulations to you that you're even willing to consider that. We simply need to take inventory and go, okay, well, if I know that I'm on a medicine, you can go to your neighborhood pharmacist and talk to them. And if that pharmacist is too busy to talk to you, you are going to take your prescriptions and you are going to go to an independent pharmacy where people tend to take more time because it's a family owned business instead of a major corporation. Ask your pharmacist. Your pharmacist, if they don't know, can at least find this information. And so, if you're going to be on medicines, let's at least take them with some cognizance of the fact that they do more to our body than just what we're told at that first 30-second or 2-minute long information session that you get about the medicine. And I swear these days you can learn a whole lot from social media too. So just follow doctors, follow pharmacists and learn and just
Yeah.
make it a lifelong learning opportunity.